Well, we spoke to Dr. Claire Taylor, a GP who started a private clinic to support long COVID patients. So Claire, how much do we know about long COVID?
So we actually know a lot about long COVID. There's still obviously more to know, but we know that long COVID is a disease that affects the blood vessels, causes inflammation. Every part of your body's got a blood supply, so that's why it can cause symptoms everywhere in your body, and it also causes inflammation in the body as well. And we also know a little bit about whether there might be some virus persisting in some people. So from a point of view of what it is, we already know quite a lot.
So how ill are the patients that you're seeing with long COVID?
These people are really, really sick, incredibly sick. So I do virtual calls as well as face-to-face. And on virtual calls, there are people who are in bed, who haven't been out of bed, sometimes for a year. And they've got people looking after them, families to help. Sometimes they can't actually speak on the videos because they're so sick. So I have a range of people, but the sickest ones are incredibly sick.
That's just awful. And can you offer them any treatment?
So at the moment, we can treat symptoms. So about half of people with long COVID have a condition called postural orthostatic tachycardia syndrome, called POTS. And it causes a rise in the pulse when you stand up. But it isn't just as simple as that. It causes chest pain, shortness of breath, palpitations, and that is treatable. So we can treat that. And probably around about half get something called mast cell activation syndrome, which is an allergic type response. So the immune system that deals with allergies starts to think there's an allergy when there isn't one. And we can also treat that. And we can treat the difficulties with unrefreshing sleep. And there's some other things that we can do. So actually there's quite a lot we can do, but I feel like in the UK we're getting left behind a little bit. And other countries are sort of soaring ahead with looking at treating the virus, if there's persistent virus, or looking at treating the blood vessels themselves. And I feel that we could get in there with it and go further. But where we're at the moment, there is treatment that we can do at the moment for symptoms.
The Scottish Government says that all NHS boards are providing assessment and support for people with long COVID. Do you think there is enough support for people living with long COVID?
So up until now, the model of the clinics was based on referring into specialists for specific things, such as a cardiologist if you have POTS, or a respiratory doctor if you have shortness of breath. And the clinics were physiotherapists and occupational therapists, which are fantastic. We need multidisciplinary teams. However, with the waiting list for specialists and non-communication between them, what we have as a result are patients that are really having difficulty coordinating their care and not really one person overseeing it. Chest, Heart and Stroke Scotland do have a free advice line, and anyone can access it, and they do a brilliant job. There are patient support groups, but from a point of view of an NHS service, the recent inquiry that I took part in was to look at whether this was sufficient, and I think from the patient submissions was over 500, that there is unmet need and people don't feel that they are supported enough.
Because down in England there are specialist long COVID centres, but none up here. I mean, is that something we should be looking at? Would that be helpful to have all the specialities under one roof, so to speak?
So I think there's various models, and at the inquiry there were doctors speaking from down south. I think they're not all perfect, but I think what you do need is you need a doctor in a clinic, whether you have different specialties or whether you have a generalist or somebody with a special interest in the middle of it. But I think the model of just referring into different specialties isn't working. I think it obviously isn't working, and hopefully the result of the inquiry will be a change to the current model that we have.
And just finally, are people still getting long COVID, or was this something we saw at the beginning of the pandemic before there was vaccinations?
So people are still getting long COVID. There are various figures about how much vaccination can reduce long COVID. The only way not to get long COVID is not to get COVID. That's the only way. Anyone can get long COVID.
Okay, Dr. Claire Taylor in Dundee, thank you very much indeed for joining us this evening.
No problem.
And that's all from Scotland Tonight. I'll be here tomorrow at 8:30. Until then, the singers in the musical Memories